It is my pleasure to welcome Dr. Chen, an interventional cardiologist at the Nanjing First Hospital in China. Today, we'll be discussing his JACC interventions manuscript presented today at TCT, IVUS-guided versus angiography-guided PCI in diabetic patients with acute coronary syndrome, the IVUS ACS trial. Dr. Chen, thank you so much for taking the time to join us and share your expertise.
Oh, thank you. Thank you.
First, can you give us a background about the topic, the questions that you and the team aim to address, and the population that you studied?
Oh, thank you very much. Basically, this is a post-hoc analysis from our pre-specified subgroup analysis of patients with diabetes and SAS. Initially, why we need to design IVUS SS trial, which was published in the Lancet this year during ACC. Because, before the conduction of our study, there are only three randomized clinical trials to compare IVUS or angiography to guided PCI for patients with SS. The first one is TCO, second one is TPAS. Also, but for our study, it's a sequential design. It means patient will be at 1 month after the PCI will be secondly randomized to DAPT or SAPT. I think the second point is not the issue we need to discuss. But for the first design, I was SS trial, all the patients with SS will be randomized to I was guided compared with angiography-guided PCI. I think this is the breakthrough research. Because before that, there was no any clear data to show IVUS guidance is superior to angiography guidance for patients with SS. After the publication of our main paper, so from the pre-specified diabetic subgroup analysis, we found several new findings from that trial. So I think this general background for this subgroup analysis. Thank you.
Yeah, I agree, and I think it's a very nice brief background of the topic, and I think an important part of the study that it was pre-specified to the diabetic patients. Can you share us what are the results that you and the team was able to find?
Yeah, actually, for this post-hoc analysis, so the primary endpoint was the same as the main paper. So it was a tidal vessel failure, so defined
Mhm.
as a cardiac death, target vessel myocardial infarction, and clinical driven target vessel myocardial infarction. So after 1 year follow-up from the paper, you can see, I have no paper right now, but I have very clear remember. So at 1 year follow-up, target vessel failure occurred in a 20 patients in the IVUS guidance, but it was 46 in the angiography guided group. So I think the Kaplan-Meier rate will be 3.6% compared with 8.3% with very significant p-value. So the reduction in the tidal vessel failure risk was mainly driven by the reduction in clinical driven tidal vessel revascularization. I think this is a key finding. But also from our main paper of IVUS SS trial, tidal vessel myocardial infarction was also reduced in the IVUS guidance group. But in this subgroup analysis, we did not find any significant reduction in the tidal vessel myocardial infarction. Even though, from the main paper, we also provided the absolute tidal vessel failure without the inclusion of peri-procedural myocardial infarction. In this subgroup analysis, we did the same thing. Also, we found significant reduction in target vessel failure without the target peri-procedural myocardial infarction. Thank you.
Yeah, and I agree, and I think the results kind of speak for themselves. And again, IVUS guided PCI demonstrates improvement in clinical outcomes. And I think the nice thing about this study is, the pre-specification of people with diabetes. Dr. Chen, how do you think we should move forward with these results?
Yeah, actually, after several publications of intravascular imaging guided PCI, actually this month in ESC, So the guideline has changed the recommendation of intravascular imaging guided PCI for patients with chronic syndrome. But still, we are waiting for the improvement of recommendation for patients with SAS. I think it's only take a short time. But the key point is that I think even the guideline has changed their recommendation level, but there is no any very clear data to support the IVUS guidance superior to angiography for patients with diabetes, particularly for patients with SS diabetes. So I do believe this post-hoc analysis is very, very important. So lastly, for our next study, we will follow our new findings. We will design next multi-center randomized trial to compare IVUS-guided and angiography-guided PCI for patients with diabetes. But the key point is that, most of diabetic patients have the very diffuse lesion. So for the next new RCT, we will define the inclusion criteria should be the diffuse lesion should not be longer than 60 minutes. If longer than 60, I think it will be very difficult to get the positive result. Thank you.
Yes, thank you so much, Dr. Chen, and thank you for joining us today and sharing your expertise with us. And we invite everyone to go over the full manuscript published today in JACC Interventions. Thank you again, Dr. Chen.